Welcome to Public Health, Introduction to Public Health, which is health education or Public Health A200 at Orange Coast College. We're going to start by talking about the definition of public health, and then we'll move on to other topics. So let's first look at a definition of public health. In 1920, Edward Winslow defined public health as the science and the art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, the education of the individual in principles of personal hygiene, the organization of medical and nursing services for the early diagnosis and preventative treatment of disease, and the development of the social machinery which will ensure to every individual in the community a standard of living adequate for the maintenance of health. So one expectation about living in a civilized society is healthy living conditions. That would include clean air, safe water, healthy food, access to medical care. And all of these things are outlined in this definition. So you can see sanitation of the environment. That has to do with environmental health. We have the control of community infection, which is infectious disease. We have education, the education of individuals. We have medical services, the organization of medical and nursing services, and then also societal organization for the delivery of these services. So further, in 1988, the Institute of Medicine's, you'll sometimes see this designated as the IOM, in their publication, The Future of Public Health, refocused attention on public health and revitalized the field. So the mission of public health is fulfillment of society's interest in assuring the condition in which people can be healthy. The substance of public health is actually the organized community efforts aimed at the prevention of disease and the promotion of health. It links many disciplines and rests upon the scientific core of epidemiology. The organizational framework of public health encompasses both activities undertaken within the formal structure of government and the associated efforts of private and voluntary organizations and individuals. So you can see that in this publication, they defined further the mission. They defined and identified the substance, outlined an organizational framework, and then they identified core functions of public health. These are assessment, policy development, and assurance. So let's look at the essential services and the core functions of public health. Here you can see on the outside of the wheel are the three core functions: assessment, policy development, and assurances. And then within the wheel, they're further broken down into 10 essential public health services. So under assessment, there's monitor health status to identify and solve community health problems. There's also the diagnosis and investigation of health problems and health hazards in the community. So that would encompass monitoring health and diagnosing and investigating disease. Under policy development, we have inform, educate, and empower people about health issues. We have mobilize community partnerships and action to identify and solve health problems. And then third, we have develop policies and plans that support individual and community health efforts. So those are the three essential public health services under policy development. Then we have assurances. There's actually 4 essential public health services under insurances. One would be enforce the laws and regulations that protect health and ensure safety. The second one would be to link people to needed personal health services and assure the provision of health care when otherwise unavailable. 3, we have assure competent public and personal health care workforce. And then lastly, evaluate the effectiveness, accessibility, and quality of personal and population-based health services. So we will look at these in greater detail as we continue through this class. But there is a final system management function of public health, and that's in the middle, and that's research. So we have research for new insights and innovative solutions to health problems. Now, the intended outcomes of public health and of the core functions of public health is the protection of health and the reduction of risk, prolonging life, also the quality of life, and then medical advances. So citizens of developed countries are healthier today than they were centuries ago, and much of this improvement is due to improved living conditions brought about by public health. Federal, state, and local governments are responsible for regulating safety of food and water supply, ensuring the quality of medical services, and sponsoring research and educational programs on causes and prevention of disease.